Hello everyone, welcome to my channel meditime.com. I am Prajwal and today we are discussing about anti-tuberculosis drugs or anti-TB drugs. This chapter is given in 6th bpharm medicinal chemistry unit number 3. So let's begin with introduction. So what is tuberculosis? Tuberculosis, it is a chronic bacterial infection that is caused by Mycobacterium tuberculosis. Here Mycobacterium tuberculosis is a pathogen that causes an infection known as tuberculosis. These are some common points related to tuberculosis. Causative agent is Mycobacterium tuberculosis. So where it will cause an infection? So the site of infection is lungs, especially alveoli cells. Because Mycobacterium tuberculosis is a kind of bacteria that needs air or oxygen to survive. Without oxygen, without air, it cannot survive. So after entering into our body, it will focus on lungs and target the alveoli cells, because inside the alveoli cells, gases exchange takes place. Alveoli cells are well ventilated compared to other cells. So it will target the alveoli cells because it needs air or oxygen to survive. So the site of infection is pulmonary alveoli. So Mycobacterium tuberculosis entered into our body and causing some infection. So it is totally abnormal to our body. So during these abnormal conditions, our immune system will try to give the response. So as we seen from last some days, immune system will give the response in the form of antibodies. But in this special case, Mycobacterium tuberculosis, immune system, rather than releasing the antibodies, it will release cells, some cells or immune cells. For example, macrophages. So here immune system will release the cell. So response is cell mediated. So it is called as cell mediated immune response. Pathogen Mycobacterium tuberculosis cell wall is bit waxy and it is slightly acidic because presence of mycolic acid. So because of this presence of mycolic acid, it will become slightly acidic. So it is called as acid fast. So it is strictly aerobic. Without air, without oxygen, it cannot survive. To alive a bacteria, to survive a bacteria, there is needs of air. Okay, so it is strictly aerobic. Cod factor, a special factor or protein that is present in Mycobacterium tuberculosis. So let's discuss about this cod factor in next slide. How Mycobacterium tuberculosis enter into our body and how it will cause an infection, let's see. Mycobacterium tuberculosis causes a TB, and TB, it is a type of transmitting disease from one individual to another individual. If a person is suffering from TB or tuberculosis, if he sneezes or if he coughs, the droplets of cough or sneeze contains Mycobacterium tuberculosis, nothing but pathogen. And these will enter into healthy individual body. And after entering to healthy individual body, these will focus on lungs, especially alveoli cells, because alveoli cells are well ventilated. To survive Mycobacterium tuberculosis, there is needs of air. So it will target the alveoli cells and try to cause an infection. To prevent the formation of infection, our immune system will give the response. And here our immune system will produce or release a cells known as macrophages. And these macrophages will engulf the bacteria. Macrophages are the type of immune cells released by a immune system, and these will engulf the bacteria or cover the bacteria or arrest the bacteria by a formation of barrier, and the barrier is known as phagosome, and the process of formation of phagosome is known as phagocytosis. So as we are familiar with one thing, that every immune cells are associated with lysosomes. So here, like macrophages also associated with lysosomes. And what these lysosomes will do, these lysosomes will combine or fuse with macrophages and release the lytic enzyme. Lytic enzyme helps to degrade or kill the pathogen, okay, to give a sidal effects. But as I told to remember one thing from last slide, that is Mycobacterium tuberculosis contain a special factor or protein, that is cord factor. What this cord factor will do? This cord factor will come in between the lysosome and phagosome, and it makes unable to fuse lysosome with phagosome. If there is no fusion, there is no release of lytic enzyme. If there is no release of lytic enzyme, there is no degradation or there is no killing of pathogen. Finally, our immune system failed to kill the pathogen, failed to give a side effects, and this entire process is known as primary TB. Our immune system totally failed to kill a bacteria. Immune system failed to give us side effects. Still Mycobacterium tuberculosis or pathogen is there in our body, is there in our alveoli cells. So again, after 3 weeks, immune system will try to give the response. This time, immune system will send some cells to cover the pathogen. So the immune cells will come and adhere at the surrounding of pathogen, and they will form one structure. The structure is known as granuloma, and this process is known as granuloma formation. So because of addition of these immune cells at the site of infection, necrosis takes place. Necrosis in the sense tissue death or cell death takes place. So this will cause a tissue death. This is known as gone focus, and further it undergo calcification, replication, multiplication, and finally it leads tuberculosis. Okay, so this is about pathophysiology of tuberculosis. Among 95% of peoples, TB is there, tuberculosis is there, but in inactive form. In the sense, TB is there, pathogen is there, but in rest phase. It is not causing any harmful effect, or the individual not showing any symptoms of TB, and even it is not transmitting from one person to another person. Such a TB is known as inactive TB or latent TB. So further 5% people remains. So in those 5% people who are suffering from immunosuppressive diseases or whose immune system is very weak, in such individuals, TB is in active form. In the sense, it is causing harmful effect to body, and even it is transmitting from one person to another person. Let's move towards our actual concept, that is anti-TB drugs or anti-tubercular drugs. So first thing is classification based on chemical nature, based on chemical moiety, or based on pharmacological action, based on clinical utility. These drugs are classified in various types. Okay, so the first classification is according to clinical utility. According to clinical utility, the drugs are classified into 3 classes. One is first line drugs, second one is second line drugs, and third other drugs. Why these drugs are called as first line drugs? Because whenever you consult a physician, whenever you consult a doctor, if you diagnosed with TB, he will suggest or he will prescribe some common medications, and those common medications are first line drugs. Why these drugs are commonly prescribed? Because these drugs having high effect or high anti-TB action and low toxic effect or low toxic effect. Okay, so because these drugs are called as first line drugs. So now second line drugs. What are these second line drugs? Second line drugs are nothing but after prolonged consumption of these first line drugs, years together, months together, consumption of these first line drugs, our body will form a resistance, and that time the first line drugs were not work. That time second line drugs were given. Okay, so first line drugs are there, second line drugs are there. Then what are these other drugs? As we seen from majority of classifications, there is presence of other drugs and miscellaneous drugs. So now question is arising, why these drugs are called as other drugs? Why they kept as other drugs? See, of course these drugs having anti-TB activity. With this, they having some other action also. For example, amoxicillin. Amoxicillin is a common antibiotic. With this, it is a anti-TB drug also. Okay. Nowadays, these drugs, these first line drugs, second line drugs, and other drugs are given in combination therapy. Combination therapy in the sense one drug plus one drug is combined and given. In the sense, based on their feature, based on the chemical nature, based on the severity of the patient, these drugs will combine and give. That phenomena is known as combination therapy. So this is about based on chemical nature. These drugs are classified into first line drugs, second line drugs and other drugs. So now second classification according to chemical moiety. According to chemical moiety, these drugs are classified into 5 categories. One is salicylic acid derivatives. For example, para-amino-salicylic acid, that is also called as PASA. Pyridine derivatives or pyridine derivatives. For example, ethionamide. And pyrazine derivatives, example pyrazinamide. And fourth one is ethylene diamino-butanol derivatives, for example ethambutol. And fifth one is antibiotics, for example streptomycin, cycloserine, rifampicin and kanamycin. So these are the examples for anti-TB drug. This classification is given in KD Tripathi book. You can refer this also. So in next video we'll discuss about further things like study of individual drugs, their structure, their structural activity relationship, synthesis, uses and mechanism of action.